Welcome to Skyscape's free webinar series. Today's topic is Clinical Judgment, Helping Students Build Critical Habits. I am Kristen Snowden-Smith from Skyscape, and I will be the moderator today. This webinar is being recorded and will be available on demand with a copy of the presentation. We will notify you when it is available via email. Our speaker today is Dr. Tim Bristol. Tim is a faculty and student success specialist. He works with a number of colleges and universities and resides in Minneapolis, Minnesota. Tim has been utilizing technology in the classroom, clinical, and lab setting for over 20 years. His motto is, "Today we will learn how to learn." I will now hand the floor over to Dr. Bristol.
Thank you, Kristen, and thank you everyone that's joining us live today, everyone that's joining us online. I'm really excited about where we are headed in nursing education right now because we are starting to line up more and more with what's happening in practice, and we're starting to align our lesson plans, our learning activities with what's happening in practice, and what's happening at NCLEX is they're aligning their exams to where we are in practice. I want to start off by going to the heart of the matter. According to research from NCLEX, a majority of medical errors are being linked to a lapse in clinical judgment, and there's a number of areas where you can get to that data. Most importantly, the National Council website, and I really encourage you to go there when you get a chance. Take a look at National Council's website, look up Next Generation NCLEX. But the idea here is with clinical judgment and the model that they're creating is clinical judgment is the doing that happens after critical thinking and clinical decision making. Whether you're watching live online right now or watching via recording, could you just do me a favor and say the word doing? Good job. You know, when we talk about doing, that's where the rubber meets the road, is what they're finding out at National Council. So for instance, they'll ask a critical thinking question and they'll assess that critical thinking happened, but when they sent researchers into the clinical agency, the doing that came after that wasn't there. It was oftentimes missing. And so what we need to be thinking about when a student is studying, when a student is sitting in our lecture hall, when a student is doing a psychomotor skill, everything from trach care to teaching a patient how to use an incentive spirometer, where is the nurse? Where is the nurse in what I am studying? If a student is sitting in a big lecture hall, small lecture hall, taking notes about what you're lecturing on, faculty, where is the nurse? They always need to be asking themselves that, and we've got to encourage them to do that. When we think about clinical judgment and the doing that happens after critical thinking and clinical decision making, it's about what the student is doing. So if your student is leaving a learning experience and they haven't been in the doing mode, the doing mindset, then that learning experience may not have been as effective as it could have been. Let me give you an example. Your students are learning about taking vital signs, and they're learning things like, what happens if I use a blood pressure cuff that's too big? What happens if I use a blood pressure cuff that's too small? They're learning the right answer to that question. But what does it look like in practice? What is that scenario in practice? Let me give you that scenario real quick and see if you can pull out the doing, there we go with that word again, that's happening. So students, you're in report. You're getting report for your patients. And while you're in report, your unlicensed assistive personnel, your CNA, is looking everywhere for that blood pressure cuff so that they can take vitals on your patient. And finally, after looking all over the unit, the equipment's lost and gone and I can't find it, looking all over the unit, the CNA finds a blood pressure cuff in the bottom of a supply cart, and on that blood pressure cuff is written the word thigh, T-H-I-G-H. And they go in and they use it on your average sized adult male's bicep. Okay, this person weighs 190 pounds, 200 pounds. They go in and they take that blood pressure using that thigh-sized cuff on a bicep. What I want you to do, students, is I want you to write down the number that they get using a thigh-sized blood pressure cuff on an average adult male. And let's just pretend like there's nothing blood pressure related wrong with them. Write that number down. Now, students, what I want you to do is I want you to talk to your neighbor. Did you get the same number? Why not? Are your numbers in the same range? Do you see, faculty? This is the doing that happens after critical thinking, clinical decision making. On a test, you can answer the question. I know if I use a blood pressure cuff that's too large on a patient's bicep, I will get a false low. And you know what might be the results of that false low? We actually might hold their blood pressure medication. We might give them a different medication. We might implement some other part of the care plan because equipment was used improperly. You see, we've got to take the students to the next step. We can't stop with what's the right answer when you use a blood pressure cuff that's too big. So we're going to do some exploration of how to make clinical judgment a habit. Clinical judgment needs to be a habit. And the reason it needs to be a habit is because the student must access their clinical judgment skills, abilities in the middle of a chaotic, crazy environment, okay? A little math problem here for you. My son is a nurse at a hospital here in Minneapolis. He's on an 18-bed unit. He got to work one night. They had 17 patients. By the time he left, they had 13 admissions. Think about that for a moment. 17 beds filled out of 18. By the time he left, his shift was over. They had 13 admissions. You do the math. Clinical judgment needs to be a habit, because if it's not a habit, when Christopher is challenged in the clinical environment that way, he will not be able to access clinical judgment. It's got to be a habit that he develops, that our students develop starting from day one of nursing school. Medical errors being the third leading cause of death in America. It should not be that way. And it's even more distressing to me as an educator, as a nurse, as a father of a nurse. 50% of new nurses are involved in medical errors. It can't be that way. We can't have this. 65% of medical errors involve a clinical judgment lapse, an issue with clinical judgment. It's just, these numbers should not be. Clinical judgment has got to be a habit. How do we form a habit? The student, the learner, the future nurse, gets to use a strategy, gets to find ways of consistently approaching problems, consistently implementing interventions, consistently taking action. And they've got to be able to do it in many different ways, in many different environments, okay? So think about it, a habit of processing. What habit can they use while they're reading and while they're in lecture that points towards a transfer to practice, as in, okay, I'm reading right now. I'm reading chapter 10. You told me to read chapter 10 and I'm a good student. I'm going to do it, okay? I'm reading chapter 10. So how do I do that as if I were taking care of a patient? Because if I'm not reading in a way that's going to allow me to transfer what I'm reading to practice, you see, what are your students thinking about many times when they're reading? What are your students thinking about many times when they're in lecture? What are they thinking about? They're thinking about the exam that you're going to give next Friday. That's what they're thinking about. And so what we have to do is show them, how do I read as if I were standing next to a patient? How do I sit in your lecture and take notes as if I were standing next to a patient? Because if you're writing good test items, here's a 10-second test item review course. Test item development course for faculty. Here's a 10-second one. If the test question does not sound like what a nurse would hear, think, smell, feel, experience in clinical, it should not be on your exam. There you go. In 10 seconds, I gave you a test item writing workshop. We've got to test the way in which they will practice. This is where that clinical judgment piece becomes very important. So the students need to study in the way that information will be used in practice. They need to learn about the principle of oxygenation while they're standing next to a patient with an oxygenation need. They need to read that chapter on perfusion as if they were caring for a patient with a dysrhythmia. Because if they can't do that, it won't transfer to practice. They need to form habits of analysis. When we think of analysis, looking at all the information coming at them, critique the information, and then apply what I know, what I've gathered, and go out there and take action. When you look at the clinical judgment model, and I don't have time to go into all the nuts and bolts of the model that National Council is creating, you can find that on their website. But when you look at that model, you're going to see that the new nurse is moving in very quickly between identifying cues. And it's really interesting how they do this. It's not just, oh, I was listening to your lungs and I auscultated crackles. That's not the model. They're actually like, I walk into a patient's room, I see a significant other crying, I'm listening to the lungs, I'm observing no eye contact from the patient, and my buzzer, my pager, my alert system just went off that the patient in the next room is getting out of bed and they shouldn't be. That is what a test item is going to start to look like on the NCLEX. Why? Because that's what happens in practice. We can't say, okay, you auscultated this patient's lungs, heard crackles, identified they may be in heart failure. We can't stop there. We have to look at everything going on. We have to analyze all the data, critique it for where are the priorities, and then take action. As we go through clinical judgment and we have our discussion today, I want you to look for these opportunities to build habits. And I have to remind you, just as we start on this screen right here with the fundamentals class, when you look at the research, so every 3 years, the National Council does research on RNs that have passed NCLEX and PNs that have passed NCLEX every 3 years, and they get like 2,500 of each, okay, that respond to this survey. And they say, what do you do at work most often? What do you do at work that's most important? The top 10, every time they do that research, the top 10 looks like a bulleted list from your fundamental syllabus. If you'd like to find this out for yourself, go to the National Council website and look for their practice analysis. You'll see the top 10 is your fundamental syllabus. The most important class in our program is fundamentals, and whether it's a PN program or RN program. And the idea here is, how do we start building these habits early in those courses? So I want to introduce you to a couple of different tools here that allow you to do that in a very quick and effective way. With the Skyscape Medical Library, what you're going to see, the new NCLEX is incorporating these clinical decision support tools, such as a page out of the drug guide, such as an image of an electronic health record. You're going to see that students are going to be asked questions where they have to actually look at that page of information out of the drug guide and tell you what's most important on that page. This is really interesting. I was just in a talk a few weeks ago. Dr. Phil Dickinson from National Council, he's one of the CEOs or COOs of NCLEX. He held up his phone. In front of 500 nurse educators, and he said, when a nurse is taking care of a patient, they need to be pulling out their clinical decision support tools and making sure that what they're doing right then and there is part of the current evidence base, but they can't read all 5 pages out of the drug guide on furosemide. They have to quickly evaluate that resource and say, what's most important for my patient right now? That's part of those cues that they're collecting. Having these resources in the student's hands while they're sitting in your lecture is no longer optional. We've got to be showing our students, while they're learning about perfusion, while they're learning about emphysema, while they're learning about restless leg syndrome, they've got to be creating habits of quickly accessing the current evidence base and critiquing it. What do I need right now for this patient? And if those habits don't start in fundamentals, it's very questionable. If Christopher, that RN at that big hospital in the middle of a huge city, will do it in the middle of practice. CUSIN talks a lot about quality and safety. They actually have a phrase called resource neglect, as in you didn't pull out your phone, you didn't access the current evidence base just in time that's appropriate for this clinical situation, for this patient's needs. So you have that, and then you have, how do I build a habit of taking all this information coming at me? Remember our discussion, I talked about the patient. It's not just auscultating the patient's lungs and identifying that you heard crackles. It's auscultating the lungs, identifying that you heard crackles. There's a significant other in the corner crying. There's a patient that won't make eye contact, and your buzzer is going off, your alert system is going off on your side, telling you that the bed exit alarm has been activated in the room next door. You see, all that comes into the decision that's made, the action that's taken as part of that clinical judgment model. So how do I do this processing? We need to create a habit, because when they go from fundamentals, when they go from our classroom into our simulation or lab environment, when they go from semester 1 into semester 2 and they start accessing med-surg, when they go from med-surg into clinical, the classroom into clinical, are they going to see a similar processing that's going to allow them to collect all those cues quickly and effectively, identify what's a priority right now, and take action? This is the challenge. This is the challenge. So what I want to do is I want to show you how we can help our students build a habit of clinical judgment. No matter where they are, no matter what they're working on, do they have the ability to quickly form these habits? With the NurseTim notebook, what we want to do is we want to have the student in the app while they're reading their textbook and they're jotting down a few notes. We want to have them in the app when they get into your classroom and you've talked for 10 minutes and you say, okay, folks, open up to this segment of the app in the NurseTim notebook app, jot down a few notes, then compare your notes with a buddy. We want them to then open their app again as they're preparing for lab. And now they're preparing for a lab that has an oxygenation component. They open up to that part of the app, and sure enough, there's their notes that they got from you in class or that they got from reading the book. And they add to those notes, they edit those notes, they continue to modify those notes. And then they take those notes with them to a simulation. They take those notes with them to clinical, and they keep going back through this process. So let me show you what this looks like. First of all, as they open the notebook app, and this is based on the clinical judgment model that has been identified as essential for practice. And again, we want them to start using this app the first day of nursing school, because the more that they use it, the more that they access it, the more that they contribute to their app, the more likely they are to have made clinical judgment a permanent habit that they will take into practice. So the first part of it is when it comes to the actual notebook, is they're opening up the app to the table of contents. And this is really powerful. No matter what they're studying in class today, no matter what they're reading in their book, no matter what type of patient assignment they run into in clinical, in the lab, in a simulation, they're going to find it in the index. And they're going to then going to go to that segment of notes that they've been collecting over time. And so this is really powerful, because this allows them to keep building on what we already have. For those of you that are into instructional design, this concept is called constructivism. Build on what you already have. Never start with a clean sheet of paper. Keep building, keep building, keep building, because every time you go back to what you've already built, two things happen. First of all, you quickly remind yourself of what you already know, what you've already practiced, what you've already experienced. That's the first thing. The second thing is you critique it. Oh, you know what? I wrote that down last semester. That's not necessarily true. Or that doesn't automatically apply to this patient who has emphysema that I'm caring for now today. Even though, yes, I took all these notes on emphysema from my class last semester, now I'm caring for an actual patient in clinical with emphysema. So the idea here is get them continuously going back to that page of notes, that segment of the app, and collecting that data. And you can see here is an example. And the student is taking notes. The student is, first of all, compare and contrast. Okay, so we're working on oxygenation gas exchange. And this could be any number. This could be any number of pathologies that can be involved in this. You could have one for asthma or emphysema or wherever you're at. But the idea here is it's not just about oxygenation. Think about it. If you have COPD as an issue, what else can be affected? Well, perfusion could certainly be affected, right? Mobility could certainly be affected. And as we're thinking about this, what other diseases might be related? What's similar? You see, compare and contrast is a very high level of processing, okay? Don't just sit here and memorize everything you know about COPD and think that that's, you know, okay, I'm done with COPD. I'm now going to learn about something completely different. That's not the case. And so these related diseases, what other diseases might have some of these components going on? Getting into your reading and what's going on in class, clinical or lab, this again is another compare and contrast. So I was reading, as you can see here, pages 387 to 390 in my big textbook. Here's what I thought was really important information from there, and I'm going to put those page numbers there because when I get to class, one thing I really want to do is compare my notes with the person sitting next to me. What did you pick out as most important? And then I'm in class, I'm sitting in lecture, oh, slide 29. Slide 29 came up and the instructor said, you know what, I saw this in clinical last week. I want to make sure that's in my notes. Now, think of how powerful all this information is as the student's going to clinical. We go down to the next part of the notes here. You'll see the priority interventions, the priority assessments. Everything that we do, we want the students thinking in the prioritization mode as if you were a nurse. Don't just study acute kidney injury trying to memorize everything you know about acute kidney injury. You can't do that. You have to always prioritize based on where is the nurse in this discussion. When National Council a few weeks ago, when they shared all the data that they've collected, doing evaluations, and by doing evaluations, I'm not talking about they sent out just a paper survey. Some of their evaluations, they actually went out and watched thousands of new nurses practice, followed them around the unit. A common denominator when there's problems, when there's lapses, when there's a misunderstanding, a common denominator is the fact that they weren't able to prioritize. And so we're going to start off right out of the gate. We're going to start off asking, where are the priorities? When you're using the notebook app, the nice thing here is they get to prioritize as if they were a nurse because they click on the Smart Link button down here. And for instance, maybe they're working on priorities of care. Okay, I don't know a lot about acute kidney injury, but if I Smart Link, I can go to my diseases and disorders resource that's on my device. I can go to that particular area and take a look at what's coming up related to this as far as nursing is concerned, as far as the nursing process is concerned. And I can start to make some judgments. I can start to exercise that clinical judgment muscle. That's the word I was looking for. And I can start to ask myself, what's a priority when a nurse is caring for a patient with acute kidney injury, that acute renal failure? What's a priority? And we have to be careful. Faculty, here's a little tip, okay? This is what I am showing you is what we need the student to be doing, okay? If you do it for them, if you give them the list of priorities, you know what you've done. See, prioritization is a very high level processing. It's one of the most powerful ways to learn is when you prioritize. The problem is if the students get in the middle of a learning experience and they're handed a list of priorities from the faculty member, they're going to say, oh, this is the right answer. So what we have to keep challenging them to do over here on the far left, make your own list of priorities. Make your own list of priorities. And are they going to get it right every single time? No, they're not. But what they need to do is they need to keep building this habit of critiquing the information they're about to receive, critique that information, and then start thinking about where are the priorities? What should I be most concerned about? This image here on the far left, is similar to an image that's going to start showing up in the new NCLEX, and we're expecting that in a few years here. But what they're doing is they're showing them an image out of a clinical decision support tool. It could be a drug guide, could be diseases and disorders, something like that. They're showing them that image. And they're saying, what's most important? What's most important when it comes to this page of information related to the patient you're caring for right now? You can't highlight all of it. You can't. They're going to have to take their cursor. They're going to have to make a very distinct selection. If they highlight the whole page, they're going to get it wrong, because you and I both know that a nurse can't work that way. A nurse is constantly in that prioritization mindset. So they go into they're using their notebook. They're working through, how do I create these priorities? What are these priorities? How do I quickly access my clinical decision support tools, or in this case, my diseases and disorders book? Maybe you're using the clinical companion with your med-surg book, whatever it is. They've got to be able to quickly move in and out of that, collect data, and then hit the back button, go right back into their notebook and make priority ranked decisions, whether it's nursing assessment, whether it's nursing interventions, medications, complications. You can't always walk away thinking everything is important. And unfortunately, if we tell the students, hey, read chapter 38, you know what they're going to do? They're going to walk away thinking that everything in chapter 38 is important. And we know from the research that's coming out of National Council, what that means is they now have a patient that might have shown up in chapter 38 and they can't prioritize because they think that all 42 pages of chapter 38 was important. This has got to be a habit, faculty. This has got to be a habit when they are in your classroom. They've got to have their phone out, their app out, their laptop out, taking notes in a prioritization manner, using a clinical decision support tool. We've got to create that habit that they're just always looking for that quick evidence-based practice information. How do I quickly grab it and go right back into my notes and start prioritizing myself as a student doing the action of prioritization? So we have the priority area in each segment of the notebook, and then we have what I call the professional area, and this includes your QSIN, this includes your NCLEX client needs, and here's what I tell the students. The reason we put this professional area, two reasons. When it comes to a learning testing perspective, the verbiage from QSIN, the verbiage from the NCLEX client needs becomes very important, because that's the verbiage of practice. They built those competencies, those client needs, those bullets. They built it based on what happens with a nurse when he or she is standing next to a patient, when they're in a clinical setting, when they're providing patient care. So I'll say to them, for instance, we have QSIN here on this screen, I'll say to them, you know what, folks, maybe let's pretend Tim's your med-surg instructor, and Tim stood up here for 2 hours, heaven forbid, and lectured on GI med-surg for 2 hours. If Tim never once said the word safety, guess what? You're not off the hook, students. Tim still could put a safety question, and he should put a safety question on the next exam. No fair, no fair. I went through the PowerPoints. You didn't mention safety once. Guess what, students? It's not about the PowerPoints. It's about the patient. It's about the client. It's about you prioritizing. So students, do yourself a favor. Make sure with your NurseThink notebook, every time you're taking notes that you keep right on going. You went through the prioritization area. Now move on down to the professional area in the client needs. Jot down just 1 or 2 words. Go into the QSIN area, jot down 1 or 2 words, okay? So the idea here is we wanna make sure that your students are always in that clinical practice mindset. Everybody say the word doing again. Good job. I think I heard everybody say doing. Students, make sure that you definitely want to save your notes as you're moving through this. You can export it and print them out if you need to use paper in the classroom, but for the most part, the app will work just fine on your mobile device. When you exit your notes, it's going to give you an alert that it's saved successfully. You want to make sure you see that. And while you're in lecture, and maybe sometimes in lab, you can open it on your computer as well. It doesn't have to always be on your mobile device. So you can have it on your mobile so that when you're in the middle of a simulation, when you're in clinical, you can quickly access and add to and adjust and edit. Maybe when you're in lecture, you prefer to take notes on your laptop, and this is where you do it. You do it right here on your laptop, and those notes are gonna save, they're gonna cross over. It's just a really powerful tool. And faculty, when we're talking about this, you know, I really hope that you see here the ability to build a habit of clinical judgment for your students. They're taking notes in the same way, no matter which class they're in, no matter which clinical, which lab experience they're in. When they're forming habits like this, they're in that compare and contrast mindset for the concepts and the diseases. They're looking through the book for these clinical judgment nuggets. Where is the nurse in this chapter? Where do I think the nurse is? When they're sitting in your class during lecture, when they're caring for the patient in the clinical setting, where are these clinical judgment components? And that's why this is so important. You know, and the prioritization, building a habit. You can't just say, oh, you've got asthma, here are the 20 things I'm gonna do. You can't do that because, first of all, no 2 patients are alike. Secondly, as National Council has realized, it's not just what are the proper assessments for a patient with asthma. It's not there. When you listen to Dr. Dickinson from National Council talk, and this cues area is probably the area he focuses on the most. He says, we're creating an exam, we're creating a test, we're creating test items that assess for context. Context. It's not just about memorizing the proper assessment that I would do if a patient has asthma. It's about what are all the cues in the environment? Because they realize you may have gotten that question right on the exam, but now you're in a situation where the patient not only has asthma, but also there's all these other environmental and intrinsic and extrinsic factors that come into play. And they're creating context. That's why this area is so important. This prioritization area, can't overemphasize that. It's definitely something that you have to really, really focus on. Thinking about labs and diagnostics. This is really interesting. They're always asking students on the NCLEX, what's most concerning? And guess what? When it comes to the labs and diagnostics, they're not using big words like hypokalemia. You won't see that. And so what I like having students do here is I like having them write, what are you going to see that's a priority? What's a focus? And I'll even take it a step further than what you see right here. This is why it's so important to get this app into clinical. Get this app into clinical because then they can actually write numbers. right? They can write numbers. I saw that the pH was 7.3 da 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 da, okay? And then I saw that the WBC and the hematocrit and the hemoglobin, what were those numbers? I'll push them. I want them to go a little bit further. We also have an area, so there's two types of Bloom's taxonomy, and Bloom's taxonomy is that taxonomy of knowledge, comprehension, application, analysis. There's two of them. There's one from the 50s, knowledge, comprehension, application, analysis, and then there's one from 2001, remembering, understanding, applying, analyzing. At the top of it is a word called create. It's the word create. And I love this word, and National Council actually talks about this word. They talk about it at the NCLEX Invitational. They talk about create. Is your student comfortable with creating? Especially creating an argument for a change in the care plan, but create. And so we've got this area in the app called Nurse Think Quick. And I tell students, create your own mnemonic, create your own numbers, create your own scenario. And this is a great area, because what'll happen, maybe they're in my med-surg lecture with asthma, now they go to peds and OB, and they're in a school health program or a school nurse program, and they're caring for a child with asthma. They go back to their app and they're like, oh my goodness, here's this mnemonic that I learned about, that I created last semester. Now I'm caring for this 8-year-old that's wheezing like a freight train. And looky here, sure enough, these are the things we're doing for this child right now, right here, as I stand here with this school nurse. That makes learning enduring, that makes learning real, that makes learning very powerful. They are building those habits of clinical judgment. All right, we talked about the professional area, the peer review, the faculty review area, the grade tracker. What I want to do here is emphasize to the student that a couple of things. First of all, you save time studying. That would be a really good phrase for you to write down right now, faculty. I'll go ahead and pause. Write this phrase down: save time studying. You save time studying when you are comparing and contrasting what you're putting in your app to what your buddy BJ and Shankar are putting in their app. When you compare and contrast like that, students, it helps you save time studying, number one. Number two, we said clinical judgment is the number one skill needed by nurses. Guess what number two is? Professional communication. Guess what number three is? Active listening. That is research done on brand new baby nurses in practice. What are their top 3 skill needs? It's clinical judgment, professional communication, active listening. I want this peer review area to get all filled up with names and initials and dates. I want my students in clinical, in class, in lab, always compare and contrast and discuss and disagree with each other on what they put in their app. What did they put in their notebook? The faculty review area is there as well, but this is definitely not something that we fully intended for faculty to grade. Your number one job, faculty, is getting them in here to use it and do it and fill it out and edit it and revise it as they go. Using it is the key to building that habit of clinical judgment. We added the grade tracker because I always tell my students, how do you know what you don't know? And they kind of cock their head and they look at me and they're like, well, how do I know what I don't know? Students, you need to be giving yourself a quiz, an adaptive quiz, a quiz out of your SML, open up one of your NCLEX review guides, whatever. You've got to give yourself a quiz daily. And if you're giving yourself a quiz daily and you now know what you don't know because you just got some questions wrong on that practice quiz. So take 10 questions, 20 questions, okay? And anytime you get a question wrong, do something with it. Don't just read the rationale. Reading rationale is not doing. It's not remediation. Reading rationale, for the most part, is just trying to convince yourself, oh, I actually did know that. right? You've got to do something with it. The notebook is that doing part. And I'll say, you know, for instance, you just got a question wrong and oxygenation, gas exchange, asthma, COPD was part of it. You come back to this segment of your app. You look it up over here in the index. You get back to this segment of the app and you just jot down 2 or 3 words. Why did you get that question wrong? Whether you remembered it or not, or, oh, I knew that. Don't do that to yourself. Recognition and recall and remembering, those are all very low level ways of learning and assessing. So students, you've got to take your vitals daily. How do you know what you don't know? You give yourself a practice quiz, a practice adaptive quiz, and you come back into the app when you miss a question and you just jot down a few bullets. The bookmarking and the history is really useful when the students are using the app. Again, whether they're in the web app mode, using it on their laptop, or they're on their iPad or their phone or whatever, their tablet, coming back here, they can quickly access a number of the areas that they've gone into. And one thing that we have to do, remember with these habits, this can really help them if they're going in and out of certain areas frequently, because they've got to go to these pages and they've got to do quick prioritization. You'll notice National Council has actually put out the template that they're using to write these new questions that are coming out here in a few years, and they're put it out. And one of the components of it is time pressure. And so students have to quickly look at the labs, and there's going to be a bunch of H's and L on the report. They print out that report from the nurse's station. Okay, here's all the H's and L's. And they're going to have to quickly look at that and quickly look at a page out of a lab book, a lab and diagnostics book, and say, what's most important right here? What's most important for my patient right now? This is no longer optional. They've got to have their phones out constantly. They've got to have their lab and diagnostics book on their phone, opening up that medical library, that SML, and going through these and doing a quick evaluation. What's a priority right now? The same thing goes for medications. They're going to be showing students pages out of a drug guide. And I'm already writing test questions this way. I'm already writing test items this way. They're a hot spot. And I'll show them a picture of a drug guide and I'll say, place an X for this patient. Here's a little bit of scenario. For this patient, I'll show them a page like this. I'll say, place an X on the part of the drug guide that is most important for this patient right now, that you really have to know. The cue recognition habits of prioritization, this cannot be left to chance. They've got to have a way of doing this consistently with their tools. And the nice thing about this, you're looking at the Skyscape, you're looking at my drug guide, you're looking at my lab book in my Skyscape app. That's on my phone. So the students can have the same tool in your lecture as they have in your clinical. And that's really powerful because that allows them to build habits. If they're looking at 10 different things in 10 different environments, you know, and if they can't use their phone in clinical, maybe they have to wait till post-conference, maybe they have to go to their locker during a break, maybe they just don't use it there. Definitely have them using it in the lab, having used it in the simulation, having them use it in multiple classes so they can at least build that habit of prioritizing when they're looking at this type of information. We've got to have them start doing that right from the get-go when they're in lecture with us, learning about big, important concepts, right? Not sitting in class, looking at an environment full of data being thrown at them that looks nothing like what they will see in clinical. This is an instructional design trick we call bridging, and it's a very powerful way to go at it. All right, I got a little long-winded there because I am so excited about what is happening here. And yeah, so questions, comments, thoughts, ideas, concerns?
Thanks, Tim. So our attendees, if you have a question, please post it in the chat window and we will try to get to as many as we can in the time that we have. And if we aren't able to answer all your questions, we will respond via email.
Yeah, definitely. I don't mind getting some of those too. So, all right.
So, Tim, I have a question. When will the new NCLEX questions come out?
Well, what they said a few weeks ago is that they're looking to fully, let me just say this, right now they are piloting the new types of questions, and according to what we're hearing from the podium, they're very happy with the outcomes. So when you go to the National Council website and you look for that next generation NCLEX, you'll see those types of questions. And they're saying around 2023, these questions will start popping up as actual questions that affect passing and no pass in 2023. But I want to caution, Kristen, I don't want us to go, oh, good, we've got time, because we don't. Think back, Kristen, to the data that National Council is sharing. 50% of our graduates, let me make this personal, 50% of our graduates are involved in medical errors. We can't wait till 2023 to say this is important. So here's my advice to faculty. Go to National Council's website, look at those test questions that they're creating, those examples that they're creating, and use them as learning activities in every lecture, in every lab, in every post-conference after clinical. Use them as learning activities, because they're very powerful learning tools. They're not just a test question, as you'll see. They're actually caring for a patient and making a priority decision. If those tools don't work in my lecture, I need to ask myself, does my lecture work? My lecture should be the ability for them to manage those tools, those question types. So go take a look at them. You'll actually hear, if you listen to some of Dr. Dickinson's recordings, he says, use this template. He actually says, use it. We want you to use it, because it's going to help you make sure that what you're teaching is being taught in a way that can be used in practice. So I'm sorry, Kristen, you pulled my chain. I got going there.
No problem. We did get a couple questions on how much the app costs. So for that question, we do have a couple of different options. The app itself is $37.99. You can purchase the app plus a print copy for $79.99. We additionally have bundles with the app and NCLEX RN and PN products, or you can get that with a print bundle. So the price range anywhere from just the app to $37.99, or the app plus the print copy to about $80. And if you want an NCLEX plus the app and a print copy for RN, it's about $140. And we do work with nursing institutions to offer discounts to their groups. So there would be a discount off of that potentially too. You can reach out to sales@skyscape.com. I have a question about, have you heard anything about select all that apply questions on NCLEX? I heard they will continue with these but add more options. Will NCLEX give partial credit? We use SATA questions on all the exam but no partial credit. Students hate it.
Yes. You know what's worse, writing a select all that apply question or taking a select all that apply question? They're both equally okay. Select all that apply questions are not going away. As it stands right now, you are correct. You're either all correct or you get it wrong when it comes to select all that apply questions on the current NCLEX. Now, every time you listen to Dr. Dickinson talk about the next gen NCLEX, he talks about we need to figure out partial credit, okay? But he's not talking about select all that apply questions. And he actually goes the next step saying just a regular old run-of-the-mill select all that apply question, it's almost impossible to truly assess clinical judgment with that type of question. Now, what I am doing is I'm taking some of my select all that apply questions, and if I had a picture I could show you, instead of it being a select all that apply, for instance, what would be included in the teaching plan for a patient taking Epogen, for instance, instead of me having a select all that apply question, I'll actually create an image of an electronic health record, the teaching plan, and I'll have it laid out there, but there'll be something wrong with the teaching plan, and I'll turn it into a hotspot, and I'll have the student click on what part of the teaching plan is incorrect, because it looks like what they'll see in practice. They're not going to see a select all that apply question in practice. what they're going to see is a teaching plan in the electronic health record that's been created, and there's something wrong with it. And they've got to pick out what's wrong with it. So select all that apply is still going to be there for the short term as we know it. Some of the practice questions that they're using right now show students multiple screens, multiple EHRs, shows students a picture from a drug guide, what you might actually see on your phone. If you had your phone, your drug guide on your phone, they're gonna see that. And they're going to then be asked questions that may look select all that apply, but it's just more along the lines of, you know, what are priorities for the nurse and things of that nature. So, yeah.
Thanks, Tim. Another question. Clinical judgment is high level. What can we do in the early part of the nursing curriculum? I think you touched a little bit on that, but it might be good to
so
touch on
we're,
it.
I work with many different item writing teams. We've got teams of literally dozens of educators that work together, and we're talking a lot about this idea of leveling our exams, leveling our curriculum. And what we often hear people say is, okay, they're in the first class, their fundamentals foundations class, we have to give them everything at the knowledge and comprehension level. The problem is, when you look at the research National Council does on practice, it's that first class that's most important in the curriculum. So you don't want to teach the content, you don't want them learning the concepts at the lowest level that are most important. So what we've got to do, we've got to start helping them build habits early in the program. And this is why I really advocate start using the notebook app. Give them their drug guide, give them their lab book, their med dictionary, even give it all to them on their phone. And they start prioritizing and critiquing on day one of nursing school, and they're building habits using actual tools that when they come to clinical, we're going to require them to use as well. When they go to the lab, they're going to be required to use them as well. When they go into next semester, they're going to be required to use them as well. So this helps them build those habits of clinical judgment early and start to imprint everything that as I'm reading my book, I need to be prioritizing as if I were a nurse standing next to a patient, even though it's page 1 of the fundamentals book. And this is something I'm really passionate about. We've got to figure out how to get them to the bedside early on. Great question, thank you.
Thanks, Tim. One final question I have right now. Do I need to change my lesson plan to use these tools?
Great question, and it's an emphatic no. No, this is about the student building a habit of taking everything that's coming at them and processing it in a certain way. So no matter what textbook you have them purchase for Med-Surg, no matter how you teach, whether you use all PowerPoints or no PowerPoints, they need to collect data. They need to collect those cues and start creating a habit of managing it as it comes at them. And I tell that to students when I'm helping them figure out how to use the app, how to get going with the app. What I'm actually saying to them is you know, this is about you creating a habit. This isn't about how your teacher teaches or what kind of curriculum you're in or, you know, which book you like best. That's not what it's about. It's about you developing your own habit of clinical judgment. So no, I do not advocate for saying, hey, you got to change your lesson plan, your curriculum, none of that. This is meant to be a grab and go for the student in every type of environment and experience. So good question, thank you.
I do not have any further questions. Does anyone have any last minute questions? I don't see any others posted, so at this time, I think we'll close the Q&A.
All right.
And we can wrap up the webinar if you want to advance the slides for me.
Oh, yeah, okay.
All right. Thank you everyone for attending our webinar. To trial or learn more about Skyscape solutions and group savings, including our webinar special savings, you can email our sales department at sales@skyscape.com. We have many bundles. Those can be found at skyscape.com, searching by NurseTim. And your students can purchase them at any time, or you can contact us to set up a purchasing program. Additional tips for using NurseTim can be found at nursetim.com. To learn more about Skyscape solutions and partnering with us, you can go to skyscape.com/education or email sales@skyscape.com. As I stated at the beginning of this webinar will be available on demand at skyscape.com/webinars2019. And we have many other webinars from this year and last year regarding using tools in the curriculum. And any questions that come to mind afterwards, you're more than welcome to email us webinar@skyscape.com, and Tim will graciously answer any ones that are regarding these topics. Thank you for your time and have a fantastic day.
Thank you. Bye-bye.